the Republican replacement plan to Obamacare. How do you think that could affect Ohio if the Medicaid expansion is scaled back?
Well, first of all, on Medicaid expansion, it does last till 2020, but the problem is the people who are on it have a tendency to move off. They make a little bit more money, they are no longer eligible for the system. And if they go on, they have to go on at a much higher match rate, which means it puts us really in a tough situation. I hope you understand that. It would cost us more to help them, okay? And probably prohibitive. Secondly, if they make more and they go on the exchange is giving people anywhere from a $2,000 to a $4,000 tax credit. Now, I don't know exactly what it is that you get, but if I told you for your family you can get a $4,000 tax credit, you tell me what you could buy, which isn't a whole heck of a lot. There is a subsidy there, which is about half the subsidy of what's in the current law, but it goes away after 2 years. So what I would anticipate is a much more difficult period, and I think with one party trying to jam these things through, you're going to end up with a continued political fight. And will not allow us to then move to the next stage, which is to deal with the rising healthcare costs we see in our country. So I don't think this is good for our state. I've been very outspoken on it, and even if I have to go alone, I'm prepared to do that, in terms of how this affects all of us. But you think about this, if you know somebody who's mentally ill, drug addicted, or chronically ill, they have to visit the doctor on a regular basis. And if their deductible is $10,000, $12,000, $14,000, how are they going to go? Where are they going to get the money to pay these out-of-pocket expenses? So this system needs reform because the insurance markets are weakening. They're not doing well. And there's a way to get this done without having to take this, what I think is this vital coverage away from people, not just in Ohio, but across the country. The biggest way you can get somebody back to work is to get them healthy. If they're sick, it's pretty hard to go to work when you're sick.
Governor, what can the state do to fill in the gap if the feds do cut Medicaid?
I think it's really very difficult. I mean, it's tough economic times, and even into the future. So that's why I'm speaking out, because I don't think there is any easy fix to this. I mean, we're running our budgets as Larry will tell you, they're very tight, they're very tough. Not like tough like a family goes through, but it's for government it's pretty tough. And we don't have the money to make up, for example, on the Medicaid side, potentially $1 billion, $1.5 billion. We can't do that. It's really, really expensive. So there'll be a lot of people that will go without coverage, and it won't be good. Emergency rooms will be flooded again. If you listen to the hospitals and the doctors, these folks, they're beginning to tell you what the impact is, which is more visits to emergency rooms and more people who are not getting primary care or consistent care. That's a prescription for negative.
Governor, HB 1
this morning.
I did.
Dispatch on that 19 to $26 billion figure that Ohio could lose over the course of several years. Do you think those numbers are accurate?
I haven't seen the numbers, and I don't like to talk about numbers I haven't really analyzed. Sounds high.
Yeah. Governor, HB 114 was introduced
Well, I don't
last
know what
week.
HB 114
Well,
is. That
it was
a House?
it would once again, House Bill 114 would once again make renewable benchmarks optional.